Brain tumors can occur in any part of the brain, and primarily we divide them as the tumors which arise from the brain substance itself or from the surrounding structures. The surrounding structures include the meninges. Whenever the tumor comes from the meninges, it is called meningioma. The tumors can be from the skull base, and the other structures which can cause are the nerves. So a tumor can arise from the nerve. They are called schwannomas in the brain, and tumors can arise from the pituitary gland, the pineal gland, and other structures like blood vessels. They are called vascular tumors or hemangiopericytomas, and choroid plexus papillomas inside the ventricles. Now, these tumors, some of them are benign, meaning they grow very slowly, they cause pressure on the brain very, very gradually, and they take very long time to get discovered. Whereas there are some tumors which are very aggressive, they grow very rapidly, and some of the tumors, by virtue of their location, for example, if they are arising or causing pressure in an area which of the brain that controls the hand or the leg, the symptoms will be very early, and the speech area similarly, balance area. So these are the ones which manifest quite early. The symptoms will be very short. In fact, it is good if they get to know early, we can make a diagnosis early, and the size of the tumor will be smaller. Whereas in some of the locations we call as silent locations, where they do not manifest so early, so they keep growing quite large enough to cause compression in the brain. By the time the diagnosis is made, the tumors are of really large and mammoth size. Sometimes they are technically difficult to remove them. Nevertheless, today's diagnostic technology with either a CT scan and an MRI and a contrast can definitely identify even the smallest to the largest tumors, and their location, the character, and the surrounding effects of the tumor on the brain can be easily identified. The most importantly, MRI scan gives us what is called the amount of pressure that is causing in the brain, the other reactions such as swelling, edema, the displacement of various parts of the brain can be easily identified. The diffusion tensor imaging technology can clearly tell how the fibers inside the brain are displaced by the tumor. So this gives tremendous information to the surgeons, along with the 3D imaging, where we can exactly plan the size of the surgery, location, the trajectory through which we can go through, so that we can choose the safest pathway where we do at least or no damage to the surrounding important structures in the brain. At the same time, we try to remove the tumor completely.